Good morning, good afternoon, good evening. Welcome to episode number 59 of the Unboxing AI webinar series by CARPL. This is every Thursday, 11 a.m. Eastern Time, 12 noon Sao Paulo time, and 8:30 p.m. India time, where CARPL, we will call one of our friends, collaborators, customers, partners here and try to dig into their life stories around AI and try to unbox, various aspects of AI. If you do not know what CARPL is, well, we are your friendly neighborhood AI platform, bringing all of the world's AI to radiology departments through a single integration, single user interface, and a single platform, essentially. Today, really honored that we could have our good friend Dr. Fabricio Machado here on the webinar. I think Fabricio has left his clinical work and has quickly come into into the webinar today. And thank you, Fabricio, for joining us. Um, I think most people in the Latin America region know Fabricio very well, but for those of you who don't, he is the Director of Innovation and Technology at Prevent Senior, which is one of the largest, I would say IDNs in Brazil, catering essentially to the senior citizen class. He is a radiologist by training, works at the intersection of technology and AI. He's also the founder of HealthDataLab, which is the innovation department of Prevent Senior, where basically they work with data and analytics and bring a lot of tools to clinical practice. One of the nicest people I know, if I may, and very excited to have you here, Fabricio, and share your thoughts and opinions with us.
Thank you, Vidro, for the kind introduction. It's a pleasure to be here with you.
No, it's very kind of you, Fabricio. So, Fabricio, as is customary in these webinars, we would like to start off by learning from you how you would describe what you do to 5-year-olds, and you have 5-year-old twins, so you have an unfair advantage, I would say, in that regard. But yes, what would you tell a 5-year-old? What do you do?
Yes, you know, oh, as you said, this question is very interesting to me because I have 6 year old twins and a boy and a girl. So I often find myself to explaining what I do in a very simple way. Uh, when I talk about radiologist, is actually quite easy because especially to kids, I usually say special. I get or I take special pictures that let us see what's happened inside the body, like looking underneath the skin without opening anything. But when it comes to artificial intelligence and technology incorporation, I think I would say I use a kind of metaphor that the doctors are superheroes trying to fight the disease, and I help them find tools to boost their powers, like new technologies or smart strategies. I really like this metaphor because I even use it with when I talking to physicians. They
Hmm.
need to find the right tool for each specific problem. So I like this metaphor not only when I talk to my kids, but when I talk to other physicians.
But that is very relevant, Fabricio. And I am going to ask a very random question, going completely off, script. But it just struck me. Uh, do your children know what AI is?
I try to explain and I try
Do they talk
to
with ChatGPT and Gemini and all that?
yes, yeah, sometimes in a controlled environment, but I use a tool that I think the name is Teachable
Okay.
Machine. Do you know this tool?
No,
Teachable
I
Machine,
don't. I don't.
and you can create a simple machine learning tool
Uh-huh.
uh, showing, for example, toys to the computer. And I ask my kids to show, for example, a car
Yeah.
and a doll, and the two can differentiate, can see what is
Mhm.
one and what is other uh,
No, because
uh,
Fabricio, this is
toy.
fascinating to me because, uh, and then we will certainly come back to radiology AI. I don't know if the viewers are interested in this or not. I'm sure all parents are interested in this, and maybe we should do a separate webinar on AI for kids. But my children, so I also have twins, as I told you. So, they often use my phone to talk with Chat GPT, and they will talk completely random things, and I am always there. But it's a very it they know that it is not a person, but they treat the AI like a person, right? So I just feel that so it's easy for me to explain to them what I do. I just say that I am a AI maker, right? I take credit for all of the AI applications on the CARPL platform, because we don't actually make AI, but still, I I tell my kids. But it's very interesting. But we'll come back to
No,
radiology.
no, Vidur,
Yes, but please.
it's very interesting issue because subject, because, for example, sometimes I create some avatar. For
Yeah,
example, they have a grandfather that lives um, in other city,
yeah.
not São Paulo, where I'm based in. So I create an avatar that simulates their grandfather, for example.
Oh,
But
wow.
they know
Yeah,
that this is not my grandfather, but they speak with the ChatGPT, and I think it's cool, but this need to be controlled because
yeah.
sometimes the way that tool can get you in the context is not so controlled. So I I I I need to think more about this, but it's important to show them because this is the future. This is the new world we
Yeah,
are living
yeah.
in. But it's important to control and understand what they are saying, what they are listening, and so
But
it's very interesting.
Fabricio, do you think the same controlled environment and same learning is also applicable for like doctors as they start using AI? Like, I know that, you are using at least some AI applications at Prevent Senior. Uh, is it this does the same thing apply for like radiologists and adults as well, where we need to have a very controlled environment where we start exposing people to AI, or is that just like a problem with children?
No, I think the one of my tips when I talk to physicians is test a lot of tools, but in a controlled or a test environment, because we need to guarantee that patient data uh, are protected. So I think it's important to talk with childrens and with physicians and adults like the same way, and even using the same metaphors or same histories. It's interesting issue because we need to learn
Yeah.
uh, about this and to teach others how to use in test environments and controlled environments, guarantee that data is protected. So I think
No, I think
the
this is
same
this
one.
is a great conversation. My marketing team, who I'm sure is listening, we should do a complete separate webinar on like AI and kids, and get like 5 different continents, or at least 4 different continents perspective. But so Fabricio, coming back to you, since this is about you, can you tell us your journey on how you got to being involved in innovation and technology, and how much of your time do you give to clinical radiology, and like what has been Fabricio's journey, and what does your role look like today?
And today, actually, I'm, as you said, I'm a physician, a radiologist by training. But in recent years, actually since 2019, I have been working only with artificial intelligence and technology incorporation. I work at a health insurance company based on Sao Paulo, as I said, that is a verticalized company. That means the company manages the physician laboratories, outpatient clinics, hospitals. So we have a lot of data here, the gold of the data. And by 2019 or 2018, I thought, what about to transform this oil in gasoline, to transform all these things actually in gold? So I I decided to work with data and artificial intelligence, and I create the Health Data Lab sect, the department, and the owner of the company sponsors me a lot and give a lot of opportunity to do that.
But
So in
why,
this,
Fabricio? Why? Like, why did somebody give you funding to set up a AI lab, 6 years ago in 2019?
the you asked me why?
Yes.
Sorry, why? Because I
Let me
I
ask the question
I,
another
I, I
way.
talk I
Let
talk
me.
I talk to I talk a lot with the owner of the company,
Hmm.
about this, and he believes he realized that it's important to build a department engaged and that manage all data that the company Prevent Senior has. So for me, it's very rewarding because I have a lot of data and I can um, uh, create a lot of insights or a lot of actions related to the patients, related to the doctors, physicians, and related to health personnel to
Hmm.
improve the quality and access to healthcare system that we have here in the
So
company.
Fabricio, like we have a lot of radiologists who join in from across the world, and then people listen also. So if let's say, for example, I am a radiologist at a hospital system, somewhere in the world, uh, how and I want to start a similar lab in my hospital. What is the pitch that I make to the management?
Yeah, good one. Sometimes you need um, to create a pitch, but first of all, could you first of all you need to have um, courage to do that, okay? And you
Nice.
need to have I think bilingual talents. What is this
Nice.
bilingual talents? I mean, you need to know the medicine language and the technological language. It's so important. You need to to talk to engineers, to talk to developers, to talk to IT staff. First of all, you need to understand what you are doing, what you are pursuing, what you want. After that, you need to try a lot of models and to understand. And this is for me, it's a
Yeah.
uh, major thing. It's a mainly thing. You need to uh, looking for problems. You need to looking for problems because when you're looking for problems, you can tell others that you need tools to solve them problems to tackle the problem.
Yeah.
So after you create this story about problem and tools, you can create a department that can solve, that can uh, pursue, that can look for these tools and help physicians, help the health care system, help the patients, help, why not, caregivers or relatives to struggle to tackle
Yeah.
with the disease, and um, in a sustainable manner, because you need to know about return on investment and payback periods and some of this. But the first of all, look for problems.
Interesting.
Look for
I think
problems, and
Fabricio, you have put it so in such an amazing way. Courage and being bilingual, and then lastly, constantly looking for problems is just keeping your I think it's very, very insightful. Thank you for that. There's another question that we often ponder, is that we have folks such as yourself, who have dedicated their careers to AI, organizations like Preventionure that are using AI, but why is every hospital in the world not using AI yet? Like every hospital in the world has an MRI machine, every hospital has a CT, every hospital has an X-ray. Uh, what is it that can happen that can enable, like, just mass spreading of AI, and like what is it that is hindering that adoption right now, according to you?
so what I learned from that is so many teams go after algorithms and tools before um, clearly defining the clinical pain point or the specific problem. This is the first point, and I need to repeat that because it's so important.
But
For
is
example,
it not
when
same? Is it not same, Fabricio? Like the clinical pain point across every, like every hospital would have the same pain points, right? By and large.
um, I think not, because we have different problems. Let me tell you a story about, for example, chest X-rays in Brazil.
Hmm.
We don't have radiologists um, to report all these X-rays. You know, so you need, for example, a tool that can help clinicians, not radiologists, to see the X-ray, like Lunit, for example. Not merchandising here, but like Lunit. You know,
We,
Lunit
we
is a,
love we love talking about companies, Fabricio.
yes,
You can mention any. Yeah.
yeah. So like Lunit. So this is a problem in Brazil, but this is a problem related to a specific system in Brazil. Not all. We have public system, we have private system. So you need to understand the problem, and the clinical pain point, as you said, could be understood like a disease. But the disease is one point.
Hmm.
You need to understand the exercise I really like to do is uh, draw the patient journey and the physician journey, and view all the problems, all the steps that are repeated in the journey. And after that, I can create tools. So I think there's a lot of teams that go after algorithm tools before clear defining problem, like I said. And there's another problem that's a kind of economic problem, because it's difficult to calculate the return of investment
Yeah.
uh, or the payback period of these tools, because the technology need to be seen like an investment, not like a thing that we like a risk investment. But it's so important because when we can incorporate the technology in a right way, the gain are even in cost, even or in quality. And that is so rewarding because we can do that. And we have a lot of examples here at the company I worked. But I think this kind of problems seeker is important. And this is the main point here.
Could you give Fabricio a couple of examples of, like, successful AI tools? They may be imaging AI, any other AI, like any examples you can share with us?
Yeah, sure. We developed here a system that work with LLMs, and we integrate in the clinical uh, environment. So the system helps the physician access all the EHRs of the patients and have a kind of summary on the screen. So this is so important because, for example, let me um, let me say something about a consultation, scheduling of the patient. For example, if the patient has a consultation in the next month in cardiologist, if you are a clinical or a clinician, you can prescribe, for example, some exams that will help cardiologists in the future. So, what's the problem here in a verticalized model? We we take care of all the journey of the patient journey. So it's important to know the future of clinics passages and the past of clinic
Yes.
past. So
So what
we can
you're saying
create a
that,
kind of journey.
all of the patient's information is pulled into one place. Then a LLM is run on,
Yes,
and it creates like
yes.
almost a summary. And all of this happens in
So
Portuguese.
in Portuguese, and you can chat with the tool.
Oh,
So you can,
wow.
for example, um, modulate doses or know better about an event that the patient didn't say about. So it's important to have this wide knowledge of the patient. And for me, it's a kind of the tool that we, first of all, this is not easy to incorporate because we need to know a lot of about the system, a lot about the problems we are deal with, and we have a team here that are bilingual, as I said, and we talk with IT team. We have doctors here that can develop and program in my team actually. So we understand the health system, the healthcare system we are in, and after that we can create some tools that can improve the physician and the patient conditions here.
No, nice. Fabricio, let's take there's a couple of questions that have come in. First, we can take from Shrikant. He asks, is the slower adoption of advanced imaging technologies primarily due to economic constraints, or is there also a technology gap, even in areas where trained professionals are available? So is it mostly economic issues, or is it also tech issues that are slowing down the adoption of AI?
I think there are three big problems. As Sri Kant said, first of all, we have a problem related to economic. It's difficult to calculate the ROI, as I said, or
Yeah.
the economic issues.
Yeah.
Second one, we need to adopt, I think, standard based APIs like Daikon Web or something like that, this is this will facilitate the incorporation of this technology. And we have professionals trained, but sometimes they are trained, they have curriculum, but they don't have portfolios. You need
Mhm.
portfolios. You need to test the tools. You need to go over the tools and try again and talk to other physicians and understand the system as a whole, because we have a big problem in healthcare. For in individual point we have the disease, but in the population point we have the balance between quality and cost.
Yep.
And we need to think about that. One way to think about this issue is try to zoom in and zoom out. Think in individual things, and after that, think about uh, the sustainability thing.
Yeah.
It's difficult to do, but you need to first to step forward and to try with uh, some a group with 10 people, not a big group but a small group, and try to do this, and after that you can analyze and you can study this. It's difficult to demonstrate this by a prospective study, a big one. You need to try
No, I get
small,
it.
to
What you're
try.
basically saying that it's like almost like a fellowship, right? Where you are learning, let's say MRI, and you're sitting on the machine, you're doing the scan, you're doing it wrong, then you're rescanning, you're reading, it's basically you are immersing yourself in the technology. No, and
Yes.
that's great. Just last question, Fabricio, we'll take because we are almost at time. This is from Gaurav. I think you know Gaurav from my team. He says, "Hi Fabricio, thanks for joining. What are your views on information asymmetry? I'm assuming about AI amongst doctors across the globe, and how should that be addressed? So, how can doctors be educated about AI at
Yes,
scale?
it's so interesting. It's so interesting because there's a lot of information asymmetry between physicians and patients,
Yeah,
physicians and physicians, and we talk a lot about globalization, internet, and connection, but we saw this in during the Corona pandemic.
yeah,
So, the treatment of the disease was different. The diagnostic of the disease was different in China, in United States. We have a problem related to the studies related to learning subjects, and how does it work in fact.
yeah,
So I think the LLM's model break a barrier related to asymmetry of information between patient and physicians. This is the
yeah,
first related to this kind of information, mainly the LLM models. After that, I think we need to talk about, and we need to talk each other more frequently, because, for example, you have a lot of to I know you are from India, Vidur, yes, and there's a lot of things that are useful in India, and I don't know
no,
if we talked each other about that.
yeah,
Sometimes it's a good one to try in Brazil, because we only study by academic papers. It's perfect, it's good, but sometimes we need to talk each other. We need to kind of have an intuition about an issue and try, obviously in an ethical and safe manner, but we need to try this, because this is the way we can disrupt the world. We can go forward and implement this kind of technology. First technology I incorporate in my work, it's kind of, I don't know exactly what we will do with this, but I know the problem, I know the technology, let's try.
Yeah.
And this is okay. We need to learn from mistakes. It's so important. But
I think Fabricio, that's a great note to kind of end on. Unfortunately, we try to stick to time. But I think that's a great note. We need to have the courage to learn from each other, right? And I think AI, one of the greatest things LLMs have done is removed translation, right? Removed like language as a barrier. So I think you have at the end you've got a fan comment also. No questions, just a compliment. You look and talk really good, Fabricio. I don't know if you can see the question from an anonymous fan that you have, Fabricio. So if nothing, this webinar has led to you having one fan. All of us are also your fans. But no,
oh,
with
thank
that,
you.
thank you so much, Fabricio. Means a lot. And thank you for your insights, and we'll see you soon.
Thank you. I appreciate your invitation. I'm really glad to participate, and it was great to be here. Thank you, Vidur. Thank you.
Wonderful. Thank you so much, Fabricio. Thank you.
Bye
Goodbye.
bye.
Bye. Bye, everyone.